Okay, Doctor, waiting to urgently refer Miss Jones into your care, whose clinical features are consistent with topic pregnancy. Please, E should be small. Your further assessment will be appreciated. Okay, today Miss Jones presented with the complaints of worsening abdominal pain. She reported the pain being constant and severe. Along with that, she had slight vaginal bleeding, left shoulder pain since overnight. Her since night would be better. Overnight is not good with since. Okay, since night. You can just write shoulder tip pain. That's it. How long? Not very. There's no need to be very specific. You are not writing for an actual medical exam, so you can skip few things. No problem with it. Physical examination showed her vital signs were normal. Besides that, she had tenderness in right back fossa with gardening and rebound tenderness. Also, vaginal examination reveals cervical excitation with marked, markedly tender right fornix. Just see, when you're unable to write the exact word, remove that word. There's no need to write it. Just write cervical excitation with tender fornix. Simple. Make things simple for yourself so that you don't mistake. If you don't make mistake, you will pass. If you try to make things complicated just to look or just make things look fancy, you will lose your score. Okay, because the chances of getting making mistakes are high. In the meantime, her pregnancy test revealed positive results. Pregnancy test revealed positive results. Okay, so see, this is not making sense. Just write her pregnancy result came positive, or has positive, or is positive, or has come positive. Okay, and clear urine dish. If urine dish is clear, there's no need to mention it. Problem starts from here. Her physical examination. See, when you say there is the problem is when you try to specify things. This is what I'm saying. You try to make things complicated, so that the letter will look very fancy and very good, looking handsome, beautiful letter. In this, in this thinking or in this mindset, what we do, we make mistakes. Now, if you would have not specified physical examination, vaginal examination, pregnancy test, and this and that, you can just write simple. Her examination revealed tenderness in right iliac fossa and gardening or with gardening, rebound tenderness. Okay, along with uh, along with vaginal or cervical excitation. Okay, with tender fornix. Her pregnancy test has come positive or is positive or came positive. Writing in the past came positive, present is or has would be fine. Okay, and there is no need to mention. So now what I've done, these 1, 2, 3, 4, 7 lines are going to be minimized into 2 lines. Now this will look fancy, compound, okay, and a better sentence rather than writing and specifying this physical examination. This was vaginal examination. I mean, you are not writing a history of a patient who's sitting in front of you, okay. You're writing history and writing down so that you have to prescribe some medication. This is not the case. It is a scenario which they have given case and have told you to write your letter in a concise manner. What they mean by conciseness, so that you can skip the things. Simple. Conciseness means irrelevant things should be skipped. But if you are writing a jumbo letter, gigantic one, it means you are not following the criteria. Not following the criteria, they don't give you score. I have made 1 or 2 sentences might look broken, but when you combine them, will be perfectly fine. On previous visit, Miss Jones presented with complaints of low abdomen pain, more worse at right iliac fossa. Upon asking, she doesn't Exactly, remember our last mention. Okay, it is not doesn't. It is did. She did not exactly remember when you, because you're writing past. Okay, does is present because she has. Now the problem starts. What you have done previous visit, presented past. This is equal to complaints of lower abdominal pain more worse at right iliac fossa. Then you have started writing the present tense. Now this is a big problem. If you're writing the previous visits, I gave you guys a simple rule. I hope you remember. Okay, from the very first class, please apply that. Okay, there is no need to be, as I'm mentioning over and over again, write your letter. Please, for God's sake, put your letter in front of you. Give yourself 2 to 3 minutes and reread it. When you reread it, a lot of mistakes are going to be excluded. Please make the habit of rereading. If you won't be able to reread your letter in those 40 minutes that are given on the day of your exam, there could be problems. Make this thing habit, guys. Give yourself 3 to 4 minutes, reread it. I told you, Dr. Kajal, that this F and R, the capital, are big problems. Reread it, but you're not focusing on it. And if you'll not focus, exam be nearby, you will make these mistakes. And when you'll make mistakes, it will cost you. Okay. But I am keep on telling you that don't make this mistake, don't do make these mistakes. Okay, please, I don't want to break my record. It's been 4 years, like 3 years complete and one year before. Okay, none of the student have failed their writing here on this platform. I don't want any of you to be the first one. Okay, there is no Guinness World Record. Okay, so please don't do these mistakes, guys. Okay, her abdomen examination, right? Abdominal would look good. Abdominal exam should be small. Please, for God's sake, don't do these mistakes. Reveal mild right iliac fossa tendon vaginal examination. Again, see, the problem is abdominal showed this, vaginal showed this problem. Just write her examination. There is no need to specify. See, when they'll say the vaginal tenderness, they will get to know that the vaginal examination was done, and that is the reason it is showing vaginal tenderness. You can't look the neck. You can't feel vaginal tenderness on neck examination, right? This is common, guys. Okay, don't need to be specific. Words are really important. Do not waste your words, not on people, but here in your letters. Okay? Keep your words with you so that you can save the energy. Later on, when you need it, you can use them. Okay? Based on a history, Mr. Jones was asked to return by tomorrow morning for blood test. Okay, now here you're writing Mrs. Here you're writing Miss. This is also a problem. If she's unmarried, write Miss. There should be no Mrs. Okay, you will think that this is not a problem, but this is a problem. Now everywhere you're writing Miss, and here you're writing Mrs. Suddenly she was not married till here, bowel or bladder. Till here she was unmarried. But right after you have written the base, she is married. Okay, this is not making sense. Okay, so please don't do that. Again, you're writing she is single. If it's single, why it is Mrs. Okay, these are important things. I will go into more details later. First, we have to fix these things. Okay, and I'll be, crying on these things. Don't do these mistakes. medical history, she had no previous pregnancy and was taking progesterone. Okay, rest of the things are fine. Just focus on the things that I mentioned, okay? Okay, yeah, that's good that you get because it is important, okay? It's in your favor. I might look harsh sometime, but I am not I'm a harsh person at all. It's just the way I tell you guys so you don't make mistakes because I don't want any one of you to be in the position where you'll be regretting for something. So it's okay for me to be little blunt in terms of telling you your mistakes so that you don't make any mistake and later on you'll definitely will Allah praying for me and for you as well.